Ever catch your dog doing that funny little bum scoot across the rug?
Hmm.
Or maybe, your cat's been a bit too interested in their backside lately. It's a common sight for a lot of us pet parents, but, well, often we don't really know what's going on behind the scenes.
That's exactly right. And those seemingly odd behaviors can actually be a sign that your furry friend is experiencing some, real discomfort.
Right.
So today, we're diving deep into a topic that's maybe not always openly discussed, but affects quite a few pets. Anal sac disorders in dogs, and we'll touch briefly on cats as well.
Exactly. And we've got some really detailed information here to help us unpack this whole issue.
Yeah, it's pretty comprehensive.
Our goal is pretty simple, really. Understand what these anal sacs actually are, the common problems that tend to pop up, and what you, as a loving pet owner, need to know.
To help keep your animal feeling their best, yeah.
So let's get right to it. What exactly are these anal sacs we're talking about?
Okay, so think of them like two small storage bags, almost. They're located just inside your pet's anus, one on each side. Okay.
And their main job is basically to hold secretions that are produced by glands in their walls.
Secretions, like scent marking.
Pretty much. Normally when your pet has a bowel movement, the pressure helps squeeze these sacs and empty them out.
Yeah.
It leaves behind a scent that's kind of unique to them.
So it's like their own little personal signature they leave behind. That's actually kind of fascinating.
It is, yeah.
And you mentioned these secretions can be different. What does that look like in a healthy pet?
Well, they can vary quite a bit, actually. The liquid can be pretty thin and watery, or sometimes it's thicker, more like a paste. And the color can also differ quite a lot from one animal to another. There isn't one single normal.
Okay, so that gives us a baseline. Now, what are the typical problems that can happen with these sacs? The things that might cause those scooting incidents we mentioned.
Right. So the information we have here highlights 4 main types of issues.
4 main ones, okay.
Yeah. The first is impaction. That's essentially when the sacs just get blocked up and can't empty.
Blocked, got it. Then there's infection, or the technical term is saculitis. That's when the sacs become inflamed and, infected.
Makes sense.
An abscess can also form, which is basically a painful pocket of pus building up.
Ouch, okay.
And finally, there's something called neoplasia. That refers to abnormal tissue growth, which unfortunately can include cancer.
Wow, okay. That's quite a range of potential problems packed into such a small area.
It really is.
Who is most likely to experience these kinds of issues? Is it more common in certain pets, or?
It's definitely much, much more common in dogs than in cats. Cats can get them, but it's pretty rare.
Okay, mostly dogs then.
Yeah. And interestingly, age and sex don't seem to play a huge role overall, but when we look at specific problems, certain breeds do seem to be more predisposed.
Ah, breed-specific stuff. That's always useful for people to know. What does our information tell us about that?
Okay, so for anal sac impaction, the blockage, it seems smaller dog breeds are more prone, like miniature and toy poodles.
The little guys.
Exactly. Also, American Cocker Spaniels, English Springer Spaniels, and Chihuahuas seem to have a higher chance of it happening.
Okay, several smaller breeds there.
And then when it comes to neoplasia, specifically a type of cancer called adenocarcinoma,
Right.
German Shepherds, Golden Retrievers, and again, American Cocker and English Springer Spaniels are mentioned as being potentially more at risk.
So spaniels pop up for both impaction and neoplasia.
It seems that way based on this information, yeah. So
Right.
if you have one of these breeds, it's definitely something to just, be aware of, maybe keep a closer eye out.
Good to know. A little extra vigilance might be smart if your furry friend is one of those breeds. Okay, now let's get down to what we might actually see at home. If our pet is having an anal sac problem, what are the key signs we should be looking for?
Right, the clues. Well, one of the most common signs, especially if it's impaction or an infection, is anal pruritus.
Pruritus. That's itching, right?
Intense itching, yeah.
Yeah.
Specifically around the anus. And that often leads to that classic scooting behavior we talked about earlier.
The carpet scoot.
Yep, that's the one. You might also just see them being generally itchy around their back end, licking or chewing a lot.
Okay.
They might seem hesitant to poop, or maybe they strain a lot when they try, even if nothing much comes out. That's called tenesmus.
Straining, okay.
Some dogs will start chasing their tail like crazy, and you might notice a really foul-smelling discharge, definitely not feces, coming from their anal area.
That sounds unpleasant.
It often is. They might even refuse to sit down properly or hold their tail funny because it's uncomfortable or painful.
Right, because city would put pressure on it.
Exactly. And in cats, just quickly, while it's rarer, you'd maybe look out for excessive licking of their belly and the base of their tail.
Okay, that's a really helpful breakdown of what to watch for. What about if it's progressed to an abscess? Would the signs be, like, more obvious then?
Yeah, generally with an abscess, the signs tend to be more focused and often more intense. You'll likely see quite localized pain,
Just in one spot?
often just on one side, yeah. And you might see some discharge like pus or bloody fluid from that specific area. It's usually pretty tender.
Okay, that makes sense. So we know what might be happening and who it might affect more often. But what's actually causing these issues in the first place? What are the underlying reasons these problems develop?
Well, several factors can contribute. One of the really common ones is having soft stools or, ongoing diarrhea.
Ah, okay. How does that cause it?
When their bowel movements aren't firm enough, that natural squeezing action that normally empties the anal sacs during defecation,
Hmm.
it just doesn't happen effectively.
So the stuff builds up.
Exactly. It leads to retention, a buildup of secretions. Sometimes it might just be that the glands themselves are overproducing secretions.
Just making too much.
Could be. Also, skin problems in that perianal area can be a factor. Things like allergies or other dermatologic disorders can actually change the characteristics of the secretions. They might become thicker, or the balance of normal bacteria and yeast on the skin can get thrown off, which can then lead to colonization inside the sac and cause issues.
Okay. So if the sacs aren't getting that natural squeeze and maybe the secretions are getting thicker or infected, things can stagnate.
That's a good way to put it. Retained secretions create like the perfect environment for bacteria to multiply. That causes inflammation, which can lead straight to infection or sacculitis, and even abscess formation if it gets bad enough.
Right.
The information also points to other potential contributing factors like obesity may be playing a role,
Okay.
and potentially underlying infections elsewhere, which could possibly be linked to things like hypersensitivities, allergies, or even hormonal imbalances like endocrinopathies.
Wow. So it sounds like there can be a whole variety of things at play, and it's not always just one simple cause, is it?
Not always, no. It can be multifactorial.
Now, because we want you listening to be really well informed here, what other conditions could potentially look like anal sac disorders? If someone sees scooting, what else might be going on? What's the range of possibilities a vet might consider?
That's a really, really important question because, yes, several other conditions can have very similar signs, which is exactly why getting a proper diagnosis from your vet is so crucial. You can't just assume.
Right. Don't just guess.
Definitely not. So the information we reviewed lists quite a few things. For example, adverse food reactions or food hypersensitivity.
So allergies, okay.
Flea bite hypersensitivity, so flea allergies. Other skin conditions like atopic dermatitis. Even parasites like tapeworms can cause anal irritation.
Tapeworms, really? Okay.
And also, certain localized skin infections around the tail or anus, like tail fold bacterial folliculitis or Melissasia dermatitis, which is a yeast infection.
Okay.
Sometimes it can even be a compulsive behavior like obsessive anal licking, or issues further up like colitis or other intestinal disorders causing discomfort back there.
Gosh, that's a lot.
There's more. Keratinization disorders, which affect skin cell turnover. And then, of course, different types of growths or tumors in the anal region itself, not just in the sacs, things like perianal adenoma or adenocarcinoma or perianal fistulae.
Wow, that's quite a list. It really emphasizes why a vet's expertise is absolutely needed here rather than just trying to guess what's going on from Dr. Google.
Absolutely. Self-diagnosing based on scooting alone is definitely not the way to go.
So how does a veterinarian actually go about diagnosing an anal sac issue and figuring out exactly which of those problems it is or if it's something else entirely?
Well, the information suggests that usually standard blood work and urine tests are actually normal in most anal sac cases.
Okay.
The one big exception they mention is sometimes with that specific cancer, anal sac adenocarcinoma, where calcium levels in the blood might be high. That can be a clue.
Hypercalcemia. Right.
Exactly. But for the most part, the main way they diagnose it is through a physical exam, specifically by gently feeling the anal sacs during a rectal exam.
Okay, with a finger inside.
Yes, digital palpation. Normally, healthy anal sacs shouldn't be easily palpable, meaning easily felt from the outside. You usually need to feel from the inside.
Okay, so that physical palpation is really key then.
Yeah.
What might a vet feel or see during that exam if there's a problem?
Right. So if there's an impaction, they might feel one or both sacs are enlarged, maybe firm. When they gently express it, The material that comes out is usually thick, kind of pasty, often brownish.
Okay.
And if they were to look at that material under a microscope do cytology, they might see more yeast, like Malassezia, and maybe more bacteria inside the cells than you'd normally expect.
And what about if it's an infection or an abscess?
In those cases, sacculitis or abscessation, the discharge they express is likely to be frankly purulent, meaning like pus. It might be yellowish, greenish, sometimes blood-tinged, and it often has a very strong, really foul smell.
Ugh, sounds pretty unpleasant indeed.
It definitely can be. And cytology of that fluid would typically show a lot more inflammatory cells, like neutrophils, probably red blood cells from the inflammation, and again, often increased numbers of yeast and bacteria, especially bacteria inside those inflammatory cells.
Interesting. Are there any other tests they might do to get more information? Like identifying the specific bacteria?
Yeah, sometimes they do. The cytology gives a good general idea. For instance, normal secretions tend to have more of a certain type of bacteria called gram-positive cocci. Infected sacs often have a mix or maybe more gram-negative rods.
Okay.
But if the infection isn't responding well to the initial treatment, or if it's really severe, they might send a sample off for a bacterial culture and sensitivity test.
To see exactly what grows and what kills it.
Precisely. It helps pinpoint the specific bacteria involved. The source mentions several possibilities like Proteus mirabilis, Streptococcus, E. coli, Bacillus, Clostridium perfringens, even Pseudomonas. And the sensitivity tells them which antibiotics are most likely to be effective against that particular bug.
That makes sense for targeted treatment.
It does. Usually, though, x-rays or other imaging aren't needed unless they suspect something more complicated is going on, like a tumor invading nearby tissue or maybe an underlying issue causing the problem.
Okay. So once they've done the exam, maybe looked at the fluid, possibly done a culture, and they've figured out what's going on.
Right.
What are the different ways these anal sac issues can actually be treated?
Treatment really depends heavily on what the specific diagnosis is: impaction, infection, abscess, or something else.
Right. Tailored approach.
Exactly. So for simple impaction and often for mild sacculitis, the first step is usually gentle manual expression of the built-up material, getting it emptied out.
The squeezing we talked about.
Yep. If it's very painful for the pet, or if the material is really dried out and severely impacted, they might need to give the pet some sedation or even light anesthesia to do a more thorough flushing and cleaning of the sacs.
Okay. Sometimes more involved flushing is needed.
Sometimes, yeah. And in cases of infection or significant inflammation, they might also infuse medication directly into the sacs after emptying them. Usually a combination of an antibiotic and maybe a corticosteroid to reduce inflammation.
Ah, local treatment right at the source.
Exactly. Now, if there's an abscess, that needs more intervention. It typically needs to be surgically opened and drained to let all the pus out, followed by flushing and often medication.
Okay, abscesses need draining. And what about medications that the pet takes, like pills?
Yes, oral medications are very common, especially for infection or sacculitis, and after draining an abscess. Systemic antibiotics are usually prescribed to treat the bacterial infection throughout the body, not just locally.
Right.
The information mentions several specific antibiotics that might be used, depending on the suspected bacteria or culture results. Things like cephalexin, amoxicillin, combined with clavulant potassium.
Like clavamop.
Exactly. Also, clindamycin, trimethoprim sulfa, metronidazole, or sometimes fluoroquinolones like enrofloxacin or orbifloxacin, with specific dosages often varying between dogs and cats. And if there's a yeast component, an oral anti-yeast medication might be added too.
It's good to know there are different antibiotic options available depending on the situation.
Definitely. The choice depends on the severity, the likely bacteria, and the individual pet.
What about for those pets that have problems again and again, the chronic cases, or for the more serious issues like neoplasia?
Yeah, for pets that have chronic, recurring anal sac disease, constantly getting impacted or infected despite treatment's surgical removal of the anal sacs, a procedure called anal saccolectomy might be considered as a more permanent solution.
Removing them entirely.
Yes, it eliminates the source of the problem, but it's a delicate surgery with potential risks, so it's usually reserved for cases where medical management isn't working well. And for neoplasia, or cancer, surgery to remove the affected sac and any associated tumor is typically the main treatment. This is often combined with staging tests to see if the cancer has spread, and potentially other therapies like chemotherapy or radiation, depending on the type and stage of the cancer.
Right, a much more involved process for cancer.
Absolutely. And crucially, regardless of the specific issue, impaction, infection, whatever, it's really important to try and identify and treat any underlying causes if possible.
Like those allergies or dietary issues you mentioned earlier.
Exactly. If there's an underlying food allergy, managing that might resolve the anal sac issues. If it's environmental allergies, treating those might help. Addressing obesity, if that's a factor, getting to the root cause is key for long-term success.
Makes total sense. Anything else on the treatment front? Diet, maybe?
The information does mention that sometimes for pets prone to impaction, perhaps due to softer stools, feeding a diet higher in fiber may help.
How would that help?
The idea is that a higher fiber diet produces bulkier, firmer stools, which might then apply more pressure during defecation and promote better natural emptying of the sacs.
Ah, okay. Worth discussing with a vet, maybe.
Definitely something to discuss. And just briefly, it also notes that for some chronic inflammatory conditions in that area, particularly something called perianal fistulae, which can sometimes be associated, other medications like cyclosporine, which modulates the immune system, or topical tacrolimus might be used.
Okay, more specialized treatments for complex cases. It sounds like there's a whole range of treatment approaches depending on the specific situation.
There really is, from simple expression to complex surgery and long-term management.
And what about after the initial treatment? Is there any important follow-up care that owners need to be aware of? Is it just treat and done?
Oh, definitely not treat and done in many cases. Follow-up is really key. Your vet will likely want to recheck your pet, maybe weekly at first, depending on the problem, just to see how they're healing and make sure things are resolving. Continued manual expression or flushing might be needed for a period until the inflammation settles down and the sacs are emptying normally again on their own.
So monitoring is important.
Very. And if your pet ends up being on long-term medications like corticosteroids for chronic inflammation or maybe cyclosporine, the vet will likely recommend periodic blood tests and possibly urine analysis to monitor for any potential side effects from those drugs.
Right, got to watch for side effects with long-term meds.
For sure.
So, okay, let's try and bring this all together. We've covered a lot of ground. What are the main things you think our listeners should really take away from this deep dive?
Yeah, I think the key things to remember are first that anal sacs are a normal part of your pet's anatomy, but, they can sometimes become problematic.
They're meant to be there, but can cause trouble.
Exactly. Second, recognizing those early signs we talked about, the scooting, the excessive licking, straining, that foul odor that's really important for catching problems early.
Pay attention to the signs.
Definitely. Third, know that there are many different potential causes and also many different treatment options available, ranging from pretty simple stuff to more involved procedures.
Lots of options.
And finally, probably the most important point, always consult with your veterinarian if you suspect your pet is having any issues in that area. They are absolutely the best resource for getting a correct diagnosis and figuring out the right treatment plan for your specific pet.
Couldn't agree more. This deep dive has hopefully given you all a much better understanding of a topic that, let's face it, can be a bit mysterious or maybe even embarrassing for many pet owners.
Hopefully demystified it a bit.
Yeah. So here's something maybe to think about as we wrap up. Considering how much we rely on observing our pets, reading their nonverbal cues, what are their subtle signs of discomfort, maybe not just related to this, might we sometimes be overlooking? And how can we become even better, more attuned to understanding their overall well-being and their needs?
That's a really insightful question to ponder. Paying close attention to those little changes in behavior, energy levels, appetite, it can all make such a huge difference in their quality of life.
Absolutely. So keep a watchful eye on your furry companions. Trust your gut if something seems off. And when in doubt, always reach out to your vet. Think of this deep dive as just, one more tool in your toolkit for being a proactive and informed pet parent.